Hello everyone, welcome to Auricular Medicine, brought to you by Lamp Acu Wellness Foundation, Inc. Topic for today's episode is ear palpation and massage. Regardless of modality selected, strict asepsis of the ear must be maintained to prevent infection. Use hair clip to secure patient's hair away from the ear so that it does not contaminate the auricle during treatment or become attached to the sticky tapes of the pellets, magnets, seeds. Remove ear jewelry, piercings, or hearing aids for massage, diagnosis, or other modalities as needed. Palpation and massage. Massage can be applied by therapist or patient after the patient is instructed on where and how to massage the ear. Mark the spot to be massaged with a pellet or sterile marking pen, or teach patient how to do an overall ear massage. Palpation is process of detecting tender points for diagnosis or treatment by pressing on an ear point. Rubbing or applying pressure to point can treat these same points. A healthy ear point, like a healthy body acupuncture point, should not be tender when pressed or palpated. Tenderness through pressure indicates problem in area being tested. Noget accurately points out, this does not mean that all pathology is reflected in the ear, as it may take time for that pathology to be conveyed to sight. This is more likely if there are problems with nervous transmission of information. To perform palpation, use sterile stainless steel ear probe. Although probe does not pierce the skin, there is still possibility of spreading infection from person to person via unsterilized probe. Therefore, ear probes should be sterile for each patient, so use appropriate sterilization techniques. Do not swab the ear with alcohol prior to palpation, as alcohol may change the skin's electrical conductivity or remove pathological discharges like suppurations and fluids, thus affecting clinical data derived from observation or palpation. From an Oriental perspective, when performing ear diagnosis, it is not advisable or necessary to palpate every ear point. First, establish a working diagnosis. Pathology observed in the ear, along with data from other methods of diagnosis, such as pulse palpation or tongue observation, can be used to substantiate diagnosis. Points relating to diagnosis can be then palpated and sensitivity of the ear, if any, used as supporting data. Apply equal pressure in palpating points you consider using in your prescription. Points for treatment may be marked by pressing with the probe or by using sterile gentian violet marking pen, or you may simply remember the points and not mark them. After palpation, such points are treated with ear modality or even with probe employed as a massage device. Just as palpation is used for diagnosis, palpation is also used as massage treatment by either patient through self-treatment or by practitioner. Ear massage is a relaxing, enjoyable, non-invasive, and clinically effective modality for treatment of health disorders. Massage can encompass entire auricle or it can focus on specific treatment points. Doing both is recommended. Chinese folk culture abounds in tales of pulling on the ears 300 times every day to ensure a healthy life and promote longevity. Many Chinese have a story about a relative or friend who lived into his or her hundreds because they practiced ear massage regularly. A Qing Dynasty text reads, "Massaging the helix with the hands for a number of times is also called reinforcing the city wall to tonify kidney qi, prevent deafness, treat insomnia." The Chinese maintain that the ears, which pertain to the kidney, are direct manifestation of fortune, what the Chinese construe as health, wealth, longevity, prosperity. The Chinese say, the bigger the ear, the bigger the fortune. Other cultures have also viewed the ear as indicative of stamina, status, a sign of Buddhahood, or representing the seat of the soul. Massage method is more of even technique that disperses tension and simultaneously brings energy or tonifies to areas of deficiency. Keep massage simple and short. An overly complex method will be difficult for the patient or practitioner to follow and execute. Massaging the ear for too long will tend to disperse the patient's energy. Patient should remain silent during this treatment so that his energy is allowed to go deep into the body. You can lead the patient through a guided visualization of what you are doing and how the points correlate with the specific body parts so the patient can develop awareness about the points. Preferably, overall ear massage should be done prior to the body acupuncture treatment. Massage at the end of the treatment disrupts focus achieved through the body acupuncture, which sets the therapeutic intent. Make your way through following massage steps without interruption, moving smoothly from area to area. In effect, you're treating the whole body by treating the ear. Energy is directed from the top of the body, the head, downward to the toe. Thus, energy is grounded using this technique. This whole process should take 5 minutes. First, shut off the lights in the room. Sit behind the patient, who is lying supine on treatment table with eyes closed. Perform all of ear massage bilaterally and simultaneously. Begin by gently rubbing the patient's earlobe between your thumb and index finger for 10 seconds. The thumb rubs the front of the ear and the index finger supports the back of the ear. This area corresponds to head and face. Now make your way up the helix, the area that may feel brittle, crunchy, or inflexible. It should feel supple. Gently feel each section of the ear as you proceed from the end of the helix near the lobe all the way around to the crus of the helix. Massage with thumb and index finger while simultaneously gently pulling the ear outward and downward. This area corresponds to tonsils and immunity in general. Next, put your thumb inside scapha and massage downward toward the lobe. This area corresponds to points of the upper limbs. When you get to the lobe, massage the antitragus, front and back. Then, make your way up the lower antihelix crus and into the superior antihelix crus. Antitragus pertains to the brain and nervous regulation. Lower antihelix crus pertain to structures of the thorax. Superior antihelix crus to points of lower limbs. Now go into triangular fossa and massage it upward along its superior border, then across the upper border, finally downward along its inferior border. Press and hold center of triangular fossa. Triangular fossa has a mix of points, many pertaining to hormonal and nervous regulation, breathing, balancing, grounding. Put your thumb in the inferior antihelix crus. Massage downward, including the spiny portion of the lower antihelix crus. The lower antihelix crus relates to additional points in the lower part of the body. Spinal segment pertains to sacral through cervical vertebrae. Now, place your thumb in cavum concha. Rub the points in front of external auditory meatus. Then follow the border of the supratracheal notch. Massage points in cavum concha as you move laterally to the lower antihelix crus. End by pressing at the deepest point of cavum concha at the level of intertracheal notch. These points connect to organs of the thorax. Proceed to Simba concha and massage sectors 1 to 6 in ascending order. These are points pertaining to organs in the lower abdomen. Next, massage the points of the tragus in downward manner. These points connect to endocrine system and autoregulation. Massage the posterior aspect of the ear. Begin laterally at hypertension groove and massage downward. Next, massage areas pertaining to a patient's back in a downward manner and end by holding vagus point. These points regulate blood pressure and treat the back. The vagus point corresponds to the 10th cranial nerve, which regulates many body parts, digestion and nervous system in particular. Apart from generalized ear massage, vigorous massage of a chosen point can be used to pre-test its therapeutic usefulness. For instance, if the patient has frozen shoulder, vigorously massage the shoulder point in the ear with strong dispersive technique by grasping the point firmly between your thumb and index finger and rubbing quickly for about 10 seconds. Simultaneously instruct the patient to lift and move his or her shoulder. If the practitioner is pressing on the right point and is rubbing it vigorously, the patient, although wincing, will be able to move the shoulder with almost a full range of motion. This technique is useful for locating precise points to treat musculoskeletal conditions, stiff neck, lumbago, arthritic joints. This is a powerful technique analogous to needling with a dispersive technique. So prepare patient for painful sensation achieved with a strong chi arrival attained by a dispersive hand technique. Explain that pain will quickly pass when you stop massaging the point. Simultaneous manipulation of the point by the practitioner, along with the patient lifting and moving the affected area, is critical for therapeutic effectiveness. Often, this is all the treatment that is needed if the disorder is coming from chi and blood pathologies, and it can assist in healing and restoring proper flow of chi and blood to the affected area. For instance, the lumbar points may reduce pain, but surgery such as lumbar discectomy may be required to alleviate spinal compression. Then, the treatment can be reinforced with needles or continued through take-home therapies such as pellets and seeds and self-massage. Many disorders can be treated through the simple therapy of ear massage. Ear massage or press therapy can change anoxia, regulate nonspecific immunity, and strengthen anti-infection effect. This is a simple method that has valuable local and systemic benefits for the patient. Thank you very much for your attention and see you on our next videos.